Well, the Trump administration's crackdown on immigration has begun to hit the healthcare industry. Healthcare providers who help the elderly and disabled are losing foreign-born workers and struggling to hire new ones. This has the potential to be the next battleground in the immigration debate. To discuss where things might go from here, we welcome longtime immigration attorney and founder of immigration law firm USA for All, Renata Castro, back here on the LiveZone. Always good to see you, Renata.
Great to see you too. Hopefully we'll be seeing each other with positive news sometime in the future.
Wouldn't that be nice? It seems we're always talking about something negative and or perhaps could have a negative effect on those we all love and care about. Let's talk about what I just brought up. In this case, how important are foreign workers to our healthcare system?
They are essential. The number of foreign trained doctors and nurses and individuals who work in the healthcare system, because when we think of healthcare, we obviously think immediately of individuals that are high skilled, like doctors and nurses, but the support teams that are so essential to the delivery of those services. At this current time, about 60 to 75% of the workforce in support staffs throughout healthcare facilities in the United States are foreign born. So this blow that the current administration is impacting on this industry that's already so frail and that has struggled with attracting talent will impact all of us, especially as we have an aging society in the United States requiring more and more healthcare assistance as we grow older.
Yeah, well, Renata, it's no secret you have a plethora of clients, and I'm curious, with that being said, how many of those clients work within the industry?
I would say that currently the number of individuals that work in support positions, I would say that out of 10, 4 of these individuals are directly or indirectly related to healthcare and hospitality services. A large number of individuals in construction services. And when we think of construction, we have to think of large structures being built, hospitals, assisted care facilities, all these facilities that allow the delivery of quality healthcare services. So anything that's being done currently has an impact on the healthcare industry, but also President Trump has the opportunity to change the narrative. And the reason why I say that is because there are specific programs codified in American law to allow foreign trained individuals to get a green card more expeditiously, not to benefit migrants only, but also to benefit the American people who need these services. It will take the stroke of a pen and some goodwill on his part to recognize and take action on this need for the American people.
So, Renata, would that be, in your mind, the only way to really carve out an exception to targeting health and home care workers?
I don't think it's the only way, but I believe in winning all the battles that we can win. I don't think that the country is ready, and when I say the country, is the legislative body of the country is ready to have a discussion about immigration reform. I recently saw a video from George Bush, father, discussing the need for immigration reform, and this was decades ago, and we're still having this same discussion without much action. However, I think that the American people and the House and the Senate recognize that there is a need and an opportunity for healthcare facilities to legally employ those who are willing and trained to work. So why not carve out, it won't take much change in the legislative process that we currently have. It would take, in some cases, the favor of the Department of State allowing, for example, dreamers who are nurses to go abroad and receive a visa with a specific pardon, which the Biden administration tried to do. And it was kind of a botched delivery because it was at the 11th hour of his term, but it's still available. And I believe that this is something that both Republicans and Democrats, no matter where people lie on their political position, would be behind this and support this kind of immigration decision favoring healthcare workers.
You just made mention of the president's term. We now know that is, I just counted, and quite honestly, I used my fingers, 6 months now into the president's second term. With that being said, your overall take with how he has cracked down on immigration?
I think it's an unfortunate narrative that the American people bought into, that being an immigrant means you're a criminal, you're someone with some kind of handicap. And people are learning the hard way that immigrants are the essence. They are the fiber that makes this strong fabric that is the United States. They're overwhelmingly hardworking. They are pillars of the community. They create jobs. They are people who come here, like myself, no money, no language skills, and they make something out of nothing. And if that's not the essence of what the United States is, I don't know what is. Now, those that were in favor of criminals being deported are now realizing that being an immigrant is the crime that people are being deported for, and they're taking a stand against it. But I just hope that this administration realizes that this is going to cost us, the American people, a lot more than we have to lose, and they decide to do something before it's too late.
Immigration attorney and founder of immigration law firm USA for All, Renata Castro, joining us yet again on the Live Zone. Always good to see you.
Thanks for having me.